I do think you can turn this around. And I have some thoughts about this. I asked some people to come here today. In the audience is Dr. Maureen Esposito, the Executive Vice President of Clinical Services, and Dr. Jawad, the Medical Director of Transformations Treatment Center. It is a premier treatment center which specializes in drug and alcohol and therapy and support. It's a dual diagnosis treatment center, but I'm not sending you there. I think it's important to have that asset, and under the right circumstances, they have agreed to accept you into the program, correct?
Correct.
And y'all realize she's been in and out of rehab and failed a number of times, correct?
Exactly.
And anybody can be a star in rehab, right? The problem is transformation to the outside. It's that transition to the outside world. And I've made that a pet project of mine. And you all know what virtual reality is, right? When you put on goggles and wherever you look, you feel like you are right there in the moment. Here's an example. If you feel like you're actually in a race car driving, well, take a look at this and you'll see what I'm talking about. Well, I've done the same thing for the treatment world. I've created a virtual reality tool to help that transition go smoothly and prepare for triggers. Here I am in a bar. Why? Because I know that people are going to get in high-risk situations once they get out. And I want to be there in a patient's head, training folks on how to handle those high-risk situations. It offers a unique experience so patients can sit down in a face-to-face setting with me without ever leaving the safety of the facility. Certain elite rehab programs across the country have this tool as part of their protocol, including Transformations Treatment Center. And so the idea that I'm going for here is when someone like you goes into treatment and gets out, I want there to be a significant voice in your head, a significant voice in your head that stands out from all the noise, where you can say, okay, this is what Dr. Phil and I talked about. I see this in my head. We stood in a bar together and we talked about this, and it registers in my head and it becomes a trigger for coping instead of a trigger for meltdown. Because I know people can be stars in rehab, it's transitioning out, and I'm trying to create a virtual reality tool to help people do that. And it's working really, really well. And let me tell you why I'm not wanting you to go home with these people. Because you've done this time and time again, and you have failed. So why do the same thing over again? You are going to earn your way into this elite program.